Does choosing IVF automatically mean you need to start shopping for a double stroller? Nah, it's not as simple as it sounds. My name is Dr. Anuma with Bloom Fertility, and we're here to talk today about the myths surrounding multiple pregnancies with IVF. If you look at the movies or reality TV shows, you'd think twins and triplets are a mandatory part of the package. But today, we're putting bullet holes in the eye of this massively misconstrued fertility myth. Modern reproductive medicine has completely changed the playbook. Here is why many people are inclined to expect this. That is, multiple pregnancies following IVF. Decades ago, early fertility treatments emphasized numbers. Back then, in the 1990s and the early 2000s, laboratory technology was limited. So doctors would naturally routinely transfer 2, 3, or even more embryos at a time just to increase the baseline odds of achieving a single pregnancy. That makes sense because something you know may not take. You want to improve the chances. So it is therefore not so surprising that this led to a correlative spike in multiple pregnancies just in one shot. But fast forward to today, and thanks to revolutionary advancements in laboratory embryo incubation technology, genetic screening like pre-implantation genetic testing, and high-definition time-lapse embryo monitoring. Big words, we'll get to it later. Embryologists can identify the best embryos with the highest statistical chances of implantation success, which is the main issue when it comes to pregnancies. The embryos have to implant. IVF success rates are still not 100%. That is a fact. Even with the best of eggs, sperm, and the embryos, and a good uterine environment, it's still not 100%. So the standard now is to have elective single embryo transfer. However, multiple embryo transfers of at least 2 or 3 are still in practice. This may be impacted by the cultural and clinical background of the intending parents. Some clinics offer multiple embryos of at least 2 embryos to improve the chances for a successful implantation of at least one of them or the 2 of them. Sometimes multiple embryos are transferred on request by the intending couple, especially from cultures where multiple pregnancies are welcome, such as Nigeria, where we happily welcome twins. Well, for a clinical person, we wouldn't want to expect more than that for the medical implications. However, it is important to note that multiple pregnancies may significantly increase your risk of pregnancy-related complications. These include, but are not limited to, higher rates of pregnancy-induced hypertension or high blood pressure, gestational diabetes, increased risk of premature deliveries, and or low birth weight in babies. In other words, it is best to follow the advice of your fertility doctor after you've had a thorough clinical assessment and judging from your previous history. Transferring 2 embryos at once doesn't automatically double the chances of having a baby or babies. It only improves the odds. This is decided by the capacity of the embryo or the embryos to implant and then go on to develop appropriately with the right hormonal support to establish the pregnancy, if the uterine environment is adequate and well developed to encourage this to happen. It is also possible that even with transfer of more than 1 embryo, none may implant and so no pregnancy occurs. Our ultimate goal at Bloom Fertility Clinic isn't just to hand you a positive pregnancy test. Yes, this is what we aim to do. But most importantly, we want for you a fertility journey that begins with a safe treatment process that culminates into a healthy pregnancy and ends with a happy, healthy you holding on to a healthy, beautiful baby in your arms. That is the reason for it in the first place. You are in complete control of your family planning. And our mission is to make that path as safe and predictable in outcome as possible. If you've been putting off exploring fertility options, take a deep breath, stand up, and take that one step. Let's start the journey that discovers exactly what is right for you, because we aim to help you. Come, let's help you bloom.